Is healthcare reform for Americans dead? It's been President Barack Obama's top priority to get a healthcare reform bill passed, but now we're told that talks among lawmakers are on the verge of collapse. Here to shed some light on the current situation is U.S. Congressman Dennis Kucinich. Thank you so much for joining us. So we're hearing reports that talks on negotiating this healthcare bill between the House and the Senate are on the verge of collapse. What's really going on?
This particular health care bill may not be possible. However, there is an understanding among members of Congress that we need to do many things to repair our health care system. I personally am for a not-for-profit single-payer system where everyone's covered. It would take the insurance companies out of the equation. Other members want to see the insurance companies stay in business but have antitrust laws covering them and make sure they cover patients with pre-existing conditions. So healthcare isn't dead, but I think the events in Massachusetts will probably change the nature of the debate and probably cause Congress to take a deep breath and then start again with a more modest approach at a later date.
But aren't the stakes kind of high if this doesn't pass? This has been President Barack Obama's top priority. There has been so much that's gone into getting these bills through the House and the Senate. If this collapses now, is there even going to be a chance for health care reform to happen?
Oh, sure there will be. I mean, the nature of the legislative process is that you can have abrupt starts and abrupt interruptions. I mean, I participated in a 26-hour committee meeting in which 5 amendments that I offered were passed, and then saw every one of those amendments stripped later on in the process. So you can't be guaranteed anything except people commit to a continued effort. We have to pay attention to what happened in Massachusetts. People in Massachusetts essentially said, look, we're not buying what's happening in Washington right now. Pay attention to our economic problems, including jobs. We want to keep people in our homes, protect people's savings, their retirement security. Healthcare is important, one of the most important issues in our country. But the way it was addressed really wasn't the wisest way and the one that would gain the most public confidence. So I think we're going to have to start over.
What do you think are the problems with the health care bill that they're trying to negotiate? Is it the insurance companies and the basically that they're going to profit? That's your key concern?
Well, think about it. Yes, they're going to tax people with good insurance policies to pay for those who don't have any insurance. But what's really happening is that the insurance companies are being given a monopoly on health care in America. They'll get 30 million new customers. People will mandate it. They'll have to buy private insurance. And the government will subsidize that private insurance. But there's no controls on premiums, and the insurance companies will not have any antitrust laws to cover them. So that's a situation that's really untenable, especially when you're asking some people to pay taxes on health care benefits that they've already negotiated, which is, in a sense, a give back of wages. So I think there are so many problems with this bill that even the best of intentions will not be able to put this bill back together again. So I think the prudent thing to do would be to step back, get ready to put some single initiatives forward on health care, and then at a later date talk about a grander plan. But now is not the time that is going to pass the Congress of the United States.
Okay, but what about with the power of the health care lobby? Is it possible to pass the kind of plan that you're talking about?
I think it is. I mean, we have Medicare right now for senior citizens. We have veterans who are covered with a veterans health care benefit. That is, the government runs the hospitals. American people need help here. We have 47 million Americans without any health insurance at all, another 50 million Americans underinsured. That's 1 out of every 3 Americans affected directly by this. So, yes, it's possible, but we are going to have to stand up to the insurance industry. We are going to have to tell the insurance industry they can't have their way anymore. Now, that's going to take a lot of doing, especially in the United States, to take a stand against these powerful corporations. But it has to happen if we're going to give people health care, because right now, 1 out of every $3 in our health care system, $800 billion a year for corporate profits, stock options, executive salaries, advertising, marketing, cost of paperwork, has nothing to do with health care. We have to have health care dollars for health care, get the insurance companies out of the equation, have America have a health care plan that covers everyone. We have the resources to do that, but we have to have the intention to do it.
Well, thank you so much for sharing your viewpoint, and we'll have to see whether this health care bill passes in the United States. Congressman Kucinich says better off